Welcome to ERP for Healthcare podcast, where we explore how technology is reshaping the way hospitals operate, care teams collaborate, and patients heal. I'm your host Nishad, and today we are diving into a subject that's redefining the modern hospital experience: how ERP analytics is transforming patient care quality, and why Odoo ERP is emerging as a game changer in this journey. Let's start with a simple question. How many times have patients in your hospital faced delays? Not because of medical reasons, but due to administrative inefficiencies. Think about it. A delayed discharge because billing wasn't ready, a patient waiting for a lab result because data wasn't updated in time, a critical medicine out of stock because inventory wasn't synchronized with procurement. Now, these issues are not clinical, yet they directly affect patient experience and care quality. And this is where ERP analytics step in, not as another software, but as a digital nervous system that connects every pulse of your hospital. At its core, ERP analytics takes thousands of data points generated across your hospital: patient admissions, pharmacy stock, bed availability, lab reports, staff schedules, and turns them into actionable intelligence. Here's how: it tracks patient flow in real time, helping administrators balance load across departments. It also forecasts resource requirements, for example, predicting your ICU or OPD might face peak loads. It monitors consumables and medicine usage, thereby reducing stockouts and wastage. Apart from that, it also helps your finance team understand revenue leakages and bottlenecks instantly. In short, ERP analytics help hospitals move from reactive firefighting to proactive decision making, a shift that can literally save hours, resources, and in some cases, lives. Now, many hospitals believe analytics means expensive dashboards, complex tools, and months of data migration. Now, that's a myth. What's interesting about Odoo ERP is how it brings analytics into everyday operations. It's not a separate module, it's embedded across all workflows. Let me explain this. For example, in Odoo's hospital management setup, the analytics dashboard shows real time patient admissions, discharge trends, lab activity, and even pharmacy transactions all in one unified view. So, when your medical superintendent wants to know why bed turnover dropped this week, Odoo doesn't just show numbers. It reveals patterns. Maybe the billing clearance took longer or lab approvals were delayed. It's not just analytics, it's insight with context. And that's exactly what healthcare administrators have been missing. Let's take a quick example. A mid-sized 250-bed hospital in Delhi NCR was struggling with bed allocation delays and long discharge times. Each discharge required coordination between the ward, billing, pharmacy, and the housekeeping, and none of them had real time visibility. And the result? Beds stayed occupied longer than needed, emergency admissions got delayed, and patient left frustrated. When they first implemented ODRP, they started small, integrating inpatient management, billing, and pharmacy. Within 2 months, ERP analytics revealed something striking. Most discharge delays weren't because of medical formalities. They were due to pharmacy clearance lagging behind billing by an average of 35 minutes per patient. Once that was fixed using Odoo's automated workflow triggers and real time data synchronization, the hospital reduced average bed turnover time by 28% without adding staff or extra infrastructure. Now, that's the power of ERP driven insight. It didn't just make operations efficient, it made patient care faster, smoother, and more humane. What's beautiful about ERP analytics in healthcare is that it doesn't just optimize systems, it liberates people. Doctors get accurate data faster, nurses spend less time coordinating and more time caring. Administrators, on the other hand, get a real sense of control over operations. And patients, they feel the difference. When everything runs in synchronization, care becomes predictable. And predictability builds trust, the most critical currency in healthcare. So, why Odoo ERP when there are so many systems out there? Because it's modular. Hospitals can start with core modules like patient management, billing, or pharmacy, and scale gradually. It's open source. There is no vendor lock in, no rigid architecture. It has integrated finance, HR, inventory, CRM, procurement, everything work in harmony. It's analytics driven. Every module feeds into real time dashboards for data driven and data backed decisions. It's not just an ERP, it's a platform that evolves with your hospital's maturity. And the best part, even small and mid sized hospitals can adopt it without the cost or complexity of enterprise grade systems. So here's the big picture: ERP analytics isn't about numbers, it's about clarity. It's about giving your hospital the power to see, predict, and act before things slip. And Odoo ERP is making that possible, not someday, but today. If your hospital is ready to bridge the gap between operations and outcomes, it might be time to explore what Odoo ERP can do for you. Thank you for tuning into ERP for Healthcare podcast. If you found this episode insightful, follow and share it with your peers in the healthcare community. For any questions, queries, or doubts, you can drop us a line at sales at the rate of apigen.com and we'll be more than happy to assist you further. Until next time, stay data smart, stay patient first.